Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We've got some simple TMJ treatment exercises you can do yourself to stop pain in the jaw and also that clicking. Hopefully, we can help you stop them both.
Right.
So, and what we're talking about here is the temporomandibular joint, and it's also called, the problem is also called temporomandibular disorder,
Sure.
TMD. So if you have any one of these, you may want to give these a try. They're simple treatments you can do, and they're not they're not invasive, and you know, if you do them gently, there should be no harm done to the jaw.
Right.
So,
these should feel good, and if they don't, if they create pain, then it's not the thing to do. Just go on.
and that's pretty much always the case with Bob and Brad. You know, if it hurts, don't do it. I mean,
Right.
we're not no pain, no gain kind of guys. So, by the way, if you are new to our channel, like these two heads are, please take a second, take your arms, and subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go over to Facebook and like us, because Brad and I, as children, we're not liked. It's a sad story, but we're trying to turn things around. So we're getting a few likes, aren't we, Brad?
Oh, yeah. And
Here and there.
These guys like us.
So, okay, what we're talking about here, the temporomandibular joint is actually, I don't know if you got this, Lonnie. Can you get fairly close on this? So that's the joint right here. You don't have your pen, Brad.
I know. I was just thinking about that.
But
Yeah.
and there's actually a little disc in there, a little cartilage in there.
Yep.
Yeah.
Yes, there is, and that's you know, it kind of helps the smooth action of the joint.
By the way, this is Napoleon, our old skeleton, and this is Sam, our new one. Now Sam is a little bit improved because now you can see two of the main muscles that help affect the jaw.
Right.
So we have the masseter, which is a powerful closing muscle. And this one actually also helps close it and also retracts it a little bit.
It's called the temporalis.
Temporalis,
Right.
yep. So you can see that's a big muscle here. These are really great visuals because it's going to help you with doing the first step here
That
of trying to treat
self-massage?
it. Yeah, the self-massage. So if you put your hands up here and you open your jaw, you'll feel this muscle working. You feel it, Brad?
Yeah, and when you bite down, it's one of the, you can see, especially people that have thin faces, and you know, if they're chewing their food and you're watching them across the, you can see those muscles work quite well.
I don't know why you'd be watching them, but you know.
Well, if you're a therapist, Bob, you know.
Oh, that's right. We're observing all the time. Okay, so what you're going to do is you're going to just take your palms. Very simple. A lot of TMJ pain can be just because the muscles are being overused.
Right.
And so you can go ahead and you're just going to, with the, I always like the closed position for the jaw, where you take your tongue and put it on the roof of the mouth right between, behind the front teeth, right, Brad?
Yeah,
That's just a good, comfortable position for the jaw. So you're going to take your palms and you're going to work your way up on that masseter muscle. So I'm working my way up on the blue muscle here.
yeah, right there from the side up.
And it actually feels good, doesn't it, Brad?
Yeah, and we're using that pad you have right below your thumb. There's a hypothenar eminence is a technical term for it, but that's that little pad, and it's nice and soft.
I think that's the thenar.
Oh,
hypo's on this
yeah,
side.
the hypo's there. Sorry about that.
So good posture while you're doing it. Try to have good posture. And now we're going to go ahead and my glasses getting a little bit in the way here, Brad, but you can actually work up into that larger temporalis muscle. Again, just as a reminder, what it looks like, it's this red one right here.
And it's a broad muscle. And I know on mine, up over the temple, it doesn't feel so good. When I get back by the ear, boy, all of a sudden everything relaxes and it feels good.
All right, so after you've tried that and it felt fine, then you might try it with a combination here. So now you're going to go ahead and do the massage while you're gently opening the mouth. So, and again, you can keep the tongue on the top of the roof if you're able to do so.
Bob, did we talk about emphasizing good seated posture while you're doing this? I don't remember if we did.
We did not. I mentioned it once, but I was going to mention it at the end again. But yeah, we're going to show you some reasons why posture is so important when you're doing these, because it really affects the jaw and swallowing. So as you see now, the only difference now this time, we're actually opening the jaw slightly while we're doing this. And now we're going to go ahead and work up into the temporalis, and the same thing. Tongue on the roof of the mouth. I can't talk that way, so that's why I'm not doing it. and opening the jaw.
So we're actually stretching the muscle and massaging at the same time. There's nothing new about that. It's just the way you do it with the jaw muscles.
All right, next thing, if you're actually getting some clicking in your jaw or one-sided jaw pain, this is something you might try. I put some tape on Napoleon here, and you can see there's a piece of tape on the top, upper jaw and the lower jaw, maxilla and mandible, right?
There you
I
go.
remember right. And when you open up, these should still stay lined up. Okay, if yours deviates one way, like that, or maybe deviates, oh, my,
Oh, he
he
took
lost
his
his
head
head.
He's embarrassed now. That poor guy.
I'm sorry about that.
Yeah, well, that'll
Napoleon.
happen. That will happen.
Oh,
from time
let's
to
just take it
time.
off.
Yeah, well, don't worry about it. Get your hand in there for a grip.
Yeah, there we go.
There you go.
So it can also deviate that way. Now, generally what that means, it could be a little bit of a muscle imbalance, but it could also mean that you're maybe a little bit tight on the jaw on that side. So let's say if I deviate this way, you might be a little bit tight on the temporomandibular jaw on this side.
So if your chin
Joint.
goes to the left as you open up, that would be the side that's likely tight.
So what you're going to do is you're actually going to take, again, that palm, and I'm going to push against the jaw gently while I'm opening the jaw. And I've actually done this one before. I was chewing some gum, and it must have threw me off a little bit, and I actually just did this when I pushed against the jaw, did some gentle ones, and it took the pain away. So,
Right. So if you do this and it doesn't take the pain away, by
if it
chance,
hurts
if it
worse.
hurts, then you stop. It's
Right.
not. It should be very clear that it makes it feel better.
so I'm deviating this way, so I'm going to go ahead and use my, again, thenar eminence, and push right there, and gently open the mouth again, tongue on the roof.
Oh.
Tongue on the roof.
Yep.
If you deviate this way, you're going to go the opposite way. You're going to push, and you got to find the right spot here. You can find that
Right.
spot. When you go open the jaw, you should feel it kind of poking in and poking out the jaw.
Yep.
That's the spot you want to be on.
Yeah, it's really helpful to have a skeleton to really get a feel for it there and to hear that. That's why we're therapists, I guess, Bob, because we know that.
So yeah, exactly. We know exactly where to push. Now, if you are having maybe a muscle imbalance, and you want to work on strengthening the muscles so that you are lined up, you can actually just simply use your hands and do this in a mirror. And you're going to watch again. You're going to want to line up. Sometimes they put the finger for here and here, Brad, just so that they line up. You know.
And use your fingers for
Yeah.
a visual.
And this one's giving resistance as I close.
So we're closing, and this finger is actually kind of gripping into that bone,
The chin.
the chin, and offering resistance. Hard to talk when you're doing
Yeah,
this.
so what we're trying to do here, we're trying to strengthen while you have it lined up correctly. So the fingers are going to tell you, are they lined up correctly or are they off? Like, one side and the other.
Right.
If they're lined up correctly, then go ahead and give a little resistance while you're closing. You can also go the other way. You can give a little resistance while you're opening. So you're going to have them lined up, open up like that. I'm giving a little resistance as I'm opening.
You could do what we did here with Leopold. Put a little
Napoleon.
blue tape on your upper lip and lower lip, and see.
Well, you could have one of those, you could shave that way, leave that there.
Oh yeah, what is that called? The goatee or the? Well, we
There's
don't
a-
have one,
yeah,
so we don't know.
That's right. I don't ever do that. So, all right. So that's the strengthening ones you can do, and you can do. I just say like 2 or 3 sets of 10.
Sure.
And eventually, hopefully, it's just going to go lined up and stay lined up without you having to do anything.
Right.
So,
right.
all right, this is where we get to the part where we're talking about posture. It's really important that you have good posture. It's amazing how posture affects your swallowing in the jaw. I mean, just try this once. Try to take have really good posture, take a sip of water, and then lean forward like this, and then take a sip of water. And you're going to find out it's very difficult to do. The throat is closing
Not so
off.
much sipping it, but the swallow action
Right,
is what we're
the
talking
swallow
about. So yeah,
action.
swallow here and then sip, swallow there, and you'll notice the change.
Yeah, you really want to make sure you have good posture if you're having a jaw problem, because it can help. So one you're going to do is chin tucks. So Brad's demonstrating those right now. You're taking the chin and you're retracting your head. You're not going down like this,
Right.
and you're not going up. You're just backing the head up, and it's putting the head right over the shoulders. It's putting it in a good position. The next one is, because your shoulders often tend to round out with bad posture, you can do some shoulder squeezes. Can you turn, Brad? So he's squeezing his shoulder blades together here. And that's going to help line things up. And those are the ones you can do throughout the day, every hour if you like. Do a couple chin tucks and a couple shoulder squeezes, and it's going to make a big difference.
And I just wanted to add, along with the swallowing, the mechanics of the TMJ joint are also affected by that
bad
posture. I just want to emphasize that as well.
Thank you, Brad. If none of this helps, by the way, we recommend you may want to see an orthodontist that specializes in the TMJ.
Sure.
My daughter had some difficulties with grinding her teeth at night, bruxism, and she had a mouth guard made.
Sure.
And it did wonders. I mean, because she was getting headaches from her jaw,
right.
Which is not that uncommon. And she had that made, and it was just like a miracle, to be honest with you. It really worked well.
Yep, so that's, you try these things if they don't feel good and are clear, because we've had a number of people where it's clear this works well. There's no doubt about it. You don't have to work at it for a week. You know, the first time you try, you're going to notice some positive results.
And remember, just because you're having pain, it's nothing to lose your head over.
Oh, Bob, you're killing me.
All right, thanks for watching.